Hi, I am Jade, and in this video, I'm going to walk you through the anatomy of the hip and thigh region. We'll explore the the skeletal structures, muscle compartments, and nerves that power this essential region. The hip and thigh region of our body work together to help produce locomotion, which is the ability to walk around. They also help us to stand up by supporting our weight and maintaining balance. So let's get started. We're going to begin most proximally and distal and deeply with the hip bone. So let's go ahead and hide everything else and take a look at the hip bone, which is comprised of three different regions. We have the ilium, the pubis, and the ischium. If we flip it around here, we can see the regular surface of the ilium, which articulates with the sacrum to produce the sacroiliac crest. And if we flip it around the other way here, we'll see the acetabulum. Uh, Specifically, this is the lunate surface of the acetabulum, which articulates with the head of the femur to form the hip joint. So let's take a look at the femur, which is this guy right here. So, like I said, the femur and the hip joint articulate with each other to form, I'm sorry, the femur and the hip bone, the coxal bone, articulate with each other to form the hip joint, specifically here at what we call the head of the femur, which is going to be this ball-like protrusion that you see here. More distally to that, we'll see the neck of the femur. And if we flip it around posteriorly, we will see uh, two great landmarks, which are going to be the greater and lesser trochanters. And if we continue on distally, we will see the linea aspersia as well as the lateral and medial epicondyles. The neck of the femur actually is an important landmark clinically, as it is a common site for fractures, especially in older adults due to osteoporosis. Now, let's move on to the muscular part of this video. And so, flip this around anteriorly. We'll start with the anterior compartment of the thigh, and that is going to include the quadriceps, which is going to be the quadricep rectus femoris, the vastus medialis, the vastus lateralis, and if we remove the rectus femoris here, we can see internally the vastus intermedialis, the intermedius. My apologies. Um, More proximally to that, actually, we can see another important muscle here, which is going to be the iliopsoas, which is going to be comprised of the psoas major as well as the iliacus muscle here. So let's take off a few layers here, and then we can move to the medial compartment. That's going to include our adductor muscles. Now, the adductor muscles are going to move the femur toward the midline. And so we'll start with the adductor longus, the adductor brevis, and then the pectineus muscle. If we flip it around here and then add some additional layers this way, sorry, we could see the gracilis muscle as well. And so again, these muscles are going to work to pull the thigh towards the midline of the body. boom, that way. And they also help to stabilize the pelvis. They're innervated by the obturator nerve. Moving on to the posterior compartment, we can see that we have the biceps femoris. That's going to consist of both the long and the short head of the biceps of the ham of the bicep femoris. If we remove a layer, couple layers, here we can see that we have the semimembranous, and then we also have the semitendinous muscle that is going to also comprise of the posterior compartment. If we move on to the gluteal muscles, we can see that we have the gluteus maximus, the gluteal medius, and if we remove another layer, we can see that we have the gluteus minimus. We also have the tensor fascius muscle here, the tensor fasciae latae, that is going to meet with the gluteus maximus uh, to form the iliotibial tract, which is otherwise known as the IT tract. All right, y'all. Well, thanks for watching my anatomy walkthrough of the hip and thigh. I hope that it helped you see how the skeletal structure, muscle action, and nerve control all work together in this region to support movement, balance, and daily life.